Good afternoon. My name is Emmanuel Nwosu. This is my DMP project presentation. The title of my project is Create Awareness Among Type 2 Diabetic Patients to Avoid Complications. Introduction. The prevalence of type 2 diabetes in the US was approximately 34.1 million in 2018. According to CDC, type 2 diabetic makes up 90 to 95% of all diabetic cases. Diabetic is a progressive disorder leading to the gradual deterioration of glycemic control. Initiating combination therapy early may slow the deterioration of glycemic control. Advantages and disadvantages of combination therapy includes cost, side effect profile, and complications. Problems. Life modification can improve weight loss and normalize blood glucose level in type 2 diabetes. Caloric restriction enhances insulin secretion and glucose control dependence of weight reduction. A patient on very low calorie diets show improved glucose control even with minimal weight loss. First-hand experience as a medical surgical nurse taught me that most of the patients lack disease process knowledge, and also non-compliance due to certain factors such as substance dependence, economic conditions, or homelessness was a common factor to the poor glycemic control. Purpose and aims. The primary objective of this project was to implement quality improvement measures to enhance care delivery and patient-centeredness. Nurses will educate patients on diet plans and the importance of physical activities during and after hospitalization. Establishing a link between a patient and the hospital diabetic outreach unit for ongoing support. A relevant research question explores the impact of diet, lifestyle changes, and oral medication in glycemic control. The project aims to positively impact diabetes treatment outcomes. The goal is to screen for signs of diabetic for early intervention and education. Type of inquiry. The project is a qualitative improvement initiative examining patient charts and medical records. The aim is to identify trends in blood glucose level, diet, and weight, leading to policy recommendations. Recommendations we have focused on creating patient-friendly discharge instructions to provide educational implementation policy changes, and nurses playing an important role in this process. The ultimate goal is to improve care quality through clear, concise discharge instructions, and the project drew on guidelines from American Diabetic Association for achieving target glycemic control. Background: diabetic mellitus is a chronic metabolic disorder with serious complications of if unmanaged for disease control. The prevalence of diabetic is increasing due to obesity, sedentary lifestyle, and longer life expectancies. Managing diabetic requires self-care and patient education, according to Bandura. Diabetic self-management is crucial for empowering patients to manage their condition effectively. Self-management training is essential for overcoming feelings of powerlessness associated with type 2 diabetes. Significance: transition from care can prevent unscheduled readmission in acutely ill diabetic patients, enhancing care quality, according to you et al. High admission and readmission rates underscores the importance of this project. Finding may inform clinical practice, leading to a tailored educational program for diabetic patients. Implementing education policy for nurses may help reduce healthcare costs in the community. The project emphasizes the process of acquiring and applying knowledge in nursing practice. Significance to nursing practice: knowledge is a process involving the acquisition and application of information for a specific purpose. Nurses play a crucial role in the educating and treating patients with diabetes. Empirical knowledge through research is essential for evidence-based practice in nursing. Ethical knowledge guides nurses in protecting and respecting human life. Personal and aesthetic knowledge help establish therapeutic relationship with patients. Literature review: diet rich in sugar, sweetened beverages, red meat, and refined grain increase diabetic risk, according to Hosseini et al. Combined diet and physical activities programs reduce diabetic risk. Low carbohydrate Mediterranean diet delays need for medication in type 2 diabetic patients, according to Chin and Kramer. Lifestyle changes enhances glucose control and reduce complications, according to Chen and al. Glycemic control requires healthy lifestyle and proper care management. Literature review continues. Obesity affects 80 to 80% of type 2 diabetic patients, and that is a major risk factor, according to Duskaver et al. Individual glycemic control goals are essential for effective diabetic management, according to Wastum et al. Physical activity is linked to higher diabetic prevalence and poor diet habits. Intensive diet intervention maintain glycemic control and reduce medication needs according to Johansson et al. 2021. Study design and setting. The project employed a qualitative methodology. It included pre and post test design to assess the impact of the intervention. A retrospective chart review of diabetic patients admitted in Holy Cross Hospital was conducted. The study leveraged the hospital electronic medical record. The aim was to measure the effectiveness of integrated patient education in diabetic management. Study was conducted in Holy Cross Hospital. Sample and data collection. Participants were type 2 diabetic patients aged 18 years and above, admitted between January 25 and March 23, 2024. The EMRs documented the intervention, including type 2 diabetic diagnosis and educational measures. Exclusion criteria included patients under 18 years of age, and type 2 diabetic not seen in their records. Data was collected on various variables like A1C, carbohydrate intake, and vaccination status. EMR were coded to maintain confidentiality and comply with HIPAA. Data collections were limited to a minimal necessary number to achieve the project goals. Data analysis. Data was analyzed using SPSS version 27.0. Descriptive statistics described H1C level, BMI, and demographics. A significant level of 0.05 was used to test hypotheses. Resources included hospital settings, staff printed educational materials, and funds for refreshment. Data collection and analysis was handled with strict confidentiality to protect patient data. Results and descriptive analysis. The study reviewed EMRs of 45 type 2 diabetic participants aged between 65, with 44% male and 55.6% female. Baseline of A1C was 8%, BMI was 28.5 kilogram per square meter. 71.1% of nurses received diabetic education pre-intervention, and 44.4% patients received educational pamphlets pre-intervention. The study, here are the graphics obtained from the project, diabetic demographics and baseline characteristics of the participants, changing key outcomes post-intervention, qualitative analysis. Pre-intervention A1C level showed a significant decrease. Nursing education increased by 84.4% after intervention. Distribution of educational material rose by 35%. Lifestyle changes in patient increased by 66.7%. Dietary habit changes rose by 55%. A z-test showed a p-value of 0.7032, indicating no significant difference. These are graphics for A1C level post and pre, or pre and post. Key findings: there was a 55% reduction in patients with A1C down to 7.7%. Increased nursing education led to better outcomes of management, care management. Sufficient improvement was noted in dietary and lifestyle changes among the patients. Follow-up review reinforced the reliability of the findings. Educational intervention proved essential in managing type 2 diabetes. Key findings: strength. The study used a comprehensive structured approach. Retrospective chart review ensured robust objective data. Standardized measures like A1C level provided clear outcomes. In-service presentation improved practical application of findings. Strong support from the unit leadership facilitated resource allocation. Increased nursing education and material distribution showed effectiveness. Limitations: retrospective chart review may miss unrecorded patient behaviors. Sample size of 45 limits generalizability. Conducted within a single hospital unit limits applicability. Logistical changes in coordinating presentation for all staff. Some off-duty nurses were reluctant to attend the in-service. Highlights need for broader studies and continuous staff management. Post-intervention insights. Educational intervention significantly improved patient outcomes. Decreased A1C level and enhanced lifestyle knowledge were noted. Scheduling and attendance ensured underscored flexible planning needs. Continuous education and follow-up needed for novice nurses. Emphasized importance of flexible, inclusive staff educating planning. Interpretation: the structured intervention positively impacted type 2 diabetes management. A1C decreased, indicating effective patient self-management. Increased nursing education facilitated better patient education. Highlights role of healthcare provider in patient education. Conclusion: structured educational intervention significantly improved type 2 diabetes self-management. Retrospective chart review and in-service presentation were effective. Raised awareness and promoted lifestyle modification among patients. The project outcome, limitations and challenges with strong leadership support. Emphasized the importance of continuous patient and staff education. Future research and policy should focus on sustaining and expanding the interventions. These are my references, and once more, thank you for listening. Thank you for your time.